Thank you very much for being here today. We probably should be outside with this beautiful weather, so we'll make sure that the next press conference, if we're in the 50s and 60s, we'll be outside. So I want to hope everyone enjoys this great day. Today I'm going to provide a COVID update, and then Martinez will provide some more public health information and take questions here. The state numbers as of yesterday, 892 new confirmed cases, 18 new deaths were reported in the Commonwealth. In the city of Boston as of yesterday, 81 new cases of COVID in Boston, bringing our total to 59,953. There were no new deaths reported yesterday, thank God. The total people who've lost their life from the beginning of COVID is 1,286. And our thoughts and prayers go out to all the families who've lost loved ones and the families that are still and the individuals battling this virus. The latest data that we have for the week ending February 28th, an average of 4,113 Boston residents were tested for COVID each day. The 7-day average for positive tests was 176 per day. That was an average over 7 days. The average daily positive rate was 3.6%. These numbers are much better than the numbers we were seeing certainly in January, and we haven't really seen 3.6% in quite a while, so we're excited to see that. We have seen a little bit of an uptick over the last 10 days, however, which is unfortunate, and we're working on that now and working around the clock to make sure that we get those numbers as low as possible, and Marty can talk a little more about that in a little bit, because I think we're still trying to figure out what the reasoning is for that. I'm reminding everyone that we all have a role to play in keeping yourself and others safe. There are steps that everyone can take on a daily basis to continue to beat this thing. We're asking people to continue to wear a mask with a good fit. I know in the beginning we were wearing masks just to wear a mask, but now if you can wear a mask that's a good fit, and if at all possible, potentially 2 masks, that would be great. We're asking people washing your hands frequently with soap and warm water. We're continually asking people to avoid large gatherings. All of these things are especially important as St. Patrick's Day is coming up this weekend. I guess technically it's the following weekend, it's going to be St. Patrick's Day weekend, but people will start to celebrate early. So we want you to be careful during St. Patrick's Day and during the time to get out there. The parade, as you all know, is canceled this year. I'm grateful to the organizers and all the folks that took a proactive approach to cancel the parade so we wouldn't have large crowds gathering, although I know we're anxious to get back to that. Hopefully we'll be able to this time next year. We're asking people to avoid large gatherings. There should be no large gatherings of any kind. I'm asking people not to have house parties, not to have parties with that people that are not your immediate family member or in your immediate bubble. We've gotten so far. It's been about a year now where we've been battling the COVID situation here in the city, in the state, in the country, in the world, and now is not the time to let up. Now is not the time to put our guard down. We can see the light at the end of the tunnel. More and more people are being vaccinated, more and more people are getting tests, more people, fewer and fewer people are coming down with the virus, so we want to keep it that way. There are limits on private gatherings, remain at 10 people indoors and 25 people outdoors. That means that if you have 25 people in an apartment, that you're way beyond the limit. And some of this is, I wouldn't necessarily say it's scientific, but it's some of it's common sense that can let you know that you can have a good time with fewer people inside your home, and again not contract the virus. There still remains a 90-minute limit on seating in restaurants. There'll be no lines allowed outside restaurants as we think about next week as we move forward. And the city is going to be enforcing safety protocol. We're asking people, and I'm appealing to people of Boston to do the right thing. Please do the right thing. We have made so much progress in bringing these numbers down. There is a light at the end of the tunnel, as I said earlier. There is no question about it. We can see it. So don't put our progress at risk because people want to have a party at St. Patrick's Day. Again, I know it's been a very, very, very long year, and people's general tendencies to get together, and I want to as well. But just for keeping these numbers down as we continue to move forward, a 3.6% rate of COVID is a very low number. I'd like to be able to stand here next week and say that number's even gone down even further. And in a couple weeks, we don't want to see that number going up. We have plenty of opportunity to celebrate when the pandemic is over. Certainly right now we need to focus on keeping everyone safe through the final stages, we're asking people to do your part and protect your city, protect the people around you, protect your family members, protect yourself, protect the people you don't know around you, just so we can continue to move forward. I'm also reminding everyone, making testing part of your regular routine. We have over 25 testing locations in the city of Boston. We continue to support mobile testing sites that are free and open to all, regardless of symptoms. This week, our sites are in Jamaica Plain at the Anna Cole Center in at the Mildred Haley Apartments, in Hyde Park at the Boston Renaissance Charter School, in Dorchester at the Strand Theater, in Prince Hall Lodge. For more information about how to access these sites and others, go to boston.gov or call 311. And I mention these every press conference because these are kind of the open sites, and there are other places in your community health centers that do provide testing. So if you go to boston.gov, you can find out where you can get tested. We continue to support state on vaccine rollout. Right now, adults 65 years or older and adults with 2 underlying health conditions are eligible to get vaccinated, in addition to everyone eligible in phase 1 of the program, which is 75 and older in some other areas. Starting Thursday, the 11th, this Thursday, educators will be eligible. For a full update of who's eligible for COVID testing and who can get, not COVID testing, excuse me, vaccines, go to Mass.gov. And we are now able to provide weekly vaccination data for Boston residents because we're seeing mass number of people getting vaccinated. As of March 3rd, more than 113,000 Bostonians aged 16 or older have received their first dose. More than 56,000 Bostonians aged 16 and older are fully vaccinated with both doses. That's a good number. About 20% of Boston's population aged 16 or older have received at least 1 dose. So we're starting to see those doses moving quickly. About 10% of Boston's population aged 16 or older are fully vaccinated. That means that they have, with the Moderna or Pfizer vaccine, they've received both shots. I'm not sure where we are with Johnson & Johnson. Marty can talk a little bit about that one. That's the one shot that's also coming. Data is broken down by neighborhood and demographics. All of that data is available on the Boston BPHC. That's bphc.org. And the city will continue to support the state's rollout and advocate on behalf of our residents here in the city of Boston. We are working to increase equity in this process for any resident or community that may face barriers. We are focusing on access in the Black community, African American community, the Latino community, the Asian community, and the immigrant community. A lot of that is getting information out and getting trust in the vaccine, that it's okay to take the vaccine. We want to make sure that every community in the city of Boston and every neighborhood in the city of Boston has access to vaccinations. We are focusing on access for the elderly right now and those with disabilities. In Boston, we have close to 20 vaccination sites that are open and eligible to all residents. One thing I just want to say to the elderly, if you're having a hard time getting an appointment, you should call, if you're a Boston resident, call 311, ask for the Age Strong Commission, and we will help you accessing a vaccination. If you live outside of Boston and you're having a hard time accessing it, you can call 211 for the state number and they will help you. So if you're a Boston resident, 311. If you're outside of Boston, any part of the Commonwealth of Massachusetts, that's 211. Be patient. There are call takers. We will get back to you. They will get back to you. We want to make sure that we get as much help as possible to people. The areas that we have right now, vaccination sites in the city of Boston, we have 8 community-based sites. All throughout the city of Mattapan, Rosendale, Dorchester, Hyde Park, South End, East Boston, South Boston, and Allston. We have 9 pharmacies in neighborhoods. They're in Mattapan, Roxbury, Dorchester, East Boston, the South End, and Hyde Park. We have 2 mass vaccination sites here in the city of Boston. One is at Fenway Park, and the other one's at the Reggie Lewis Center in Roxbury. We will continue to hold 50% of the appointments for local residents of color, and that's from the neighborhood of around the Reggie Lewis. On Friday, we launched a mobile vaccination pilot clinic at the Martin Luther King Towers in Roxbury. This week, our mobile vaccine clinic will be going to Hyde Park. More mobile clinics will be offered in BHA communities moving forward. We're working on that now. We had a meeting yesterday to talk about the Boston Housing Authority and opening up, getting more of our residents vaccinated as we continue to move forward. I want to thank the Boston Housing Authority, Kate Bennett. I want to thank the Public Health Commission, Rita Nueves. I want to thank Boston EMS, Chief Hooley. I want to thank Emily Shea, the city's Age Strong Commission. Their teams have done an amazing job in making sure that we expand vaccination availability across the city of Boston. Over 100 senior buildings in Boston are providing on-site vaccination for their residents. That includes both public and private housing buildings. So we're working with owners of buildings and companies to make sure we get vaccines into those buildings. 10 new buildings began clinics this week. To seniors and everyone who's eligible, I urge you to take the vaccine as soon as possible. Boston residents, again, as I mentioned, 65 years old and older are eligible. You can call 311 to get connected to the city's 8 Strong Commission. Do not feel bad about calling. That's what they do. That's why we're here. And also, if you have a parent or somebody that's having a problem with a language barrier, we also have translators. So you can call City Hall 311 and we will connect everyone to make sure people have access. Also, for more information, before I get there, veterans of all ages enrolled in the VA healthcare can get vaccinated at any VA Boston healthcare facility. For more information for veterans, go to boston.va.gov. That's boston.va.gov. The CDC released new guidelines for activities that fully vaccinated people can do safely. This is available at cdc.gov. And the city will be sharing the guidance over the next few days or so as well, making sure that as people get vaccinated, they know what they can do safely, they can't do safely, and what some of the precautions still need to be taken for a while. Over the past year, the city has gotten creative to support our small businesses. We've helped restaurants get set up and online ordering. We've expanded outdoor dining, and we're distributing about $16 million of direct relief. Our outdoor dining is slated to begin in a few weeks, but I'm going to have a meeting today at 1 o'clock in my office to talk about outdoor dining to see if there's an opportunity for us to look at where that date is to see if we can move that date. Soon we'll be rolling out another great tool. It's called Be Local, the Be Local app. It will help residents find local, black-owned, women-owned, and Main Street businesses. These are businesses in the heart of our city. Customers can collect Boston points and use them like cash at participating businesses. The city will reimburse small businesses for Boston points redeemed at their establishments. As we gear up to launch this app, we're recruiting local businesses to participate. So if you're a business out there and you're a Boston business on a Main Street in a local neighborhood and you want us to promote your business and get you, try and get you more business, please contact the City of Boston, contact the Small Business Office. We're also, it's going to be open up to all businesses and restaurants, gyms, retail shops, nail salons, and more. But it really is about making sure that our local businesses as well, not big businesses, obviously, but the local businesses, they've had a really tough year here, and we want them to, the ones that are surviving, we want them to get through this next few months here so they can be successful. To learn more or sign up, go to boston.gov/belocal. This year marks exactly 1 year since the first closing of the Boston Public Schools at the beginning of this COVID crisis. It's amazing to see how far that our schools have come. Last week, BPS welcomed all students from pre-kindergarten through 3rd grade back into in-person classroom if their families opted in. Grades 4 to 8 are scheduled to return to the classroom next week, starting Monday. And grades 9 to 12 are due to return the week of the 29th, due to permitting public health data saying that it's safe, and right now the numbers look great. They joined high priority students who have been in school since the fall. We have very comprehensive health and safety measures in place with social distancing, air filterization, sanitizing, signage, and much more. I'm grateful to everyone who made this happen. I've had the opportunity to go visit schools over the last, I think I visited 4 schools last week, the week before a couple. I think I visited about 8 schools in the last 12 days. And it's great to be in a classroom watching the kids. They have their masks on. They're sitting at their own tables. There's hand sanitizer in every classroom. There's air purifiers in every classroom. The teachers are teaching literally both remote and in person. There's technology inside the classroom, and it's amazing to watch the teachers to be able to capture the attention of the kids in front of them, but also the kids on the Zoom. And I just want to thank the teachers for the work they've done. They've done some amazing work in our city. Walking into all these schools, I've had a chance to see how clean they are and the work that our custodial staff has done in our schools. It's just amazing. The lunch monitors and the folks doing the lunch, the way they have a system now in place. Kids eat their lunch or breakfast in the classroom, and all of these adults in the school are really doing amazing work, just making sure that our kids are fed. They're doing exercise in the classroom. Today, they had what was called a outdoor mask break, which meant that you lined up with the mask on, you went outside and got some fresh air. I was in the Haynes this morning, and just seeing all of these kids and adults and everyone just adapt to the times that we're in. So I just want to give a big shout out to all of our teams at Boston Public Schools. I want to thank Brenda Casilius, our superintendent, and commend her and her team at Central Office and everyone who's done an amazing job. I also want to give a shout out to the bus drivers. They have a difficult job. People don't realize how difficult their job is either. And their on-time performance rate in the last 2 weeks, I think, has been in like 97%. We didn't see that any report anywhere, so I'd love for you to report that, because if it was 30%, we'd be reading about it or seeing it in the paper. So I'd love to give them a shout out, because they've really done a really good job. I hope I just didn't jinx myself right now doing that, but it really is amazing. And seeing these kids back in school, our kids belong back in school. Our kids need to get back in school. We need to get them in there learning. We need to get them in there interacting with each other. Just watching what the long-term ramifications of coronavirus will be on our kids. I'm not sure what it is yet, but it's strange walking into a classroom and seeing a little kid come up to you and just stop short of hugging you because they know they can't because of coronavirus. It's amazing to watch. So I'm hoping that we can continue to do great things. What I've been seeing in the schools is an example of Boston coming together, getting creative, and doing the right thing for our young people. I do want to give a shout out to a couple schools. I was in the Otis the other day, and the Hernandez, and they have a food pantry of meals for families that need it during the coronavirus. I want to thank the staff and the principals and the teachers at those schools. Most schools have it. Katie's Closet is in our schools. Katie's Closet is a program that brings clothes into our schools for families that need clothes, kids that need clothes, and seeing them in our schools, and really the need for them even more so now during coronavirus has been amazing to watch. So there's a lot of great things that we're seeing in our schools. And again, to the students, to the teachers, to the staff, to the families, thank you very much. It's been incredible to see so many smiles on students' faces. That's the one thing that, being mayor of Boston, going into a school and just seeing little ones and seeing older kids as well, it's great to see, because they are our future. And it's amazing what they're able to learn and what they've been able to learn this whole time. For now, as far as the city goes, we're going to continue to monitor the data. We're going to continue to promote testing. We're going to continue to promote vaccinations. And we're going to direct the resources where we need it the most. And we need to continue to work together. And in Boston, I'm proud to say that we've worked together with the state from the very beginning of this pandemic. We need to continue to work together to make sure that we get people vaccinated and be able to kind of open up our city again. And lastly, I just want to thank again the press that's here today. From the beginning of this pandemic, you have given the information to people. You have spread along the important information that people need to know. You've given them everything they need, so I want to thank you for that as well. So I'm going to turn it over to Marty Martinez now, who will give a little update on COVID, and then we'll open for questions.
Thank you, Mayor. Just a few pieces that I'd add. As the Mayor mentioned, as our metrics have all come down since January, and we continue to see progress, which is really great, and being able to prioritize in-person learning and education, we have started to see them flatten a little bit. And we want to make sure that we continue to keep our guard up, as the Mayor mentioned. We're going to continue to monitor the data for any signs of increased activity or areas of concern. And the reason I sort of want to restate that is that it's important that we continue to get tested. When so much of what we're seeing in the news is about the vaccine and how important that is, still in Boston, 90% of folks are not fully vaccinated. And so I stress to folks that we have to make sure that if you're exposed or you're connecting with others or you're not feeling well, that you get tested. The city, with our health center partners, continue to offer testing all across the city, as the Mayor spoke of, and we want to make sure people take advantage of it. We started to see testing usage go down. We saw a slight uptick just this last week, but we really want to stress to people that they should be getting tested. If they're engaging with others or being exposed in general, it's important that we continue continue to use this critically important tool. Vaccines are here, they're coming, and people are going to get them, but it's really important that we test everyone that we need to catch new cases and work to contain them. So I can't stress that enough. We want to continue to message that. Finally, while our vaccine efforts continue to move forward, we're eager to ensure that we continue to create real access. With almost 20% of Bostonians with a first dose in their arm as of last week, we're glad to see the progress being made locally and by the state to get more residents vaccinated. In addition, we continue our efforts to get residents who've been disproportionately impacted by COVID access, which is super important. A lot of efforts going into that include direct outreach in our housing authority buildings, set aside slots at the Reggie Lewis Center, ongoing work by health centers and hospitals to have clinics in our hardest hit neighborhoods, and ongoing partnership work with community-based organizations and coalitions to get the message out into our neighborhoods. Our weekly data has shown that we're making progress, but we need to continue to keep that work happening to ensure our access occurs. This week, as the mayor mentioned, our mobile efforts will continue with our health center partners and EMS, working through our strategy as well to make sure that K-12 workers in BPS will have more widespread access to vaccinations now that they're eligible starting Thursday. And we're going to continue to do all we can to create real access for those who need it most as we continue to place equity at the heart of our strategy. So with that, if you have COVID-related questions, I'm glad to take them. Yes. Yeah, so the question is how concerned are we with the nice weather and its impact of people gathering and lines in places? To me, really concerned. I mean, public health is concerned. We love the nice weather, like everyone else, but we sort of wish that it was a little bit later and not so soon. Primarily because we want people to double down, right? We want people to make sure that they're not gathering in small groups, that they're not gathering with people outside of their households. And although we've seen it really low, we're at 3.6%, which is really important, 4,000 people tested a day. We can easily see those trends go another direction if people do not continue to do what's needed around wearing face coverings as well. In terms of restricting lines at restaurants, that's been a key part of the work that Inspectional Services has done to ensure, and our licensing board, to ensure that people don't have lines, people aren't congregating outside, whether it's spot checks, whether it's someone seeing lines and reporting that to the city. It's really, really important we don't have it. People standing outside, congregating with no mask, that's a problem. And we're going to see increases in cases if we see that. So we just can't urge everyone enough to double down and make sure that you're keeping yourself protected and healthy, even if it is beautiful outside. It's really important that we do everything we can. Yeah, no, the question is are we going to continue to monitor things like social media and others? And, a year ago, the mayor got complaints, and as did I, about what we were seeing. And as you know, we did hold our annual licensing call with businesses and providers related to St. Patrick's Day to be able to sort of talk about restrictions. And businesses want to do the right thing, so they also want to make sure that things don't happen. So we will be monitoring them. We will be stressing to make sure that there aren't those lines that are forming, not because we don't want people to have a good time, but we don't want people to get coronavirus. And so we're going to continue to do that, and licensing's made sure to work with businesses who also want to prevent that from happening on the ground. Yeah, so the mayor raised the questions about outdoor dining, and is that something we're considering? As the mayor said, he's holding a meeting a little bit later today to talk about the timeline, and we're continuing to look at that timeline. I think the balance is you want to make sure things outside are better than inside, but you also don't want to promote any kind of atmosphere that promotes people staying longer than they should. So it's all a balance, but the mayor's going to have a meeting with us shortly. Yeah, so the question is about the tourism industry and the loss that that's been taken. Obviously, from my vantage point on a public health side, it's been tough, right? And I think the mayor has said this repeatedly. We can't have an economic recovery without a public health recovery. We need people to be able to be well and not get COVID and not place themselves or employees at risk, because essential workers have also been at risk. And so it's a balance. So as we've started to see some things reopen, we have to continue to see the progress that we have around less cases, less positivity, less hospitalizations, and then we can continue to move forward with reopening. So it's all going to be a balance, but we have to look at both at the same time. I think so.
Well, he is. This week last year really was kind of surreal, looking back on it now. Had a couple meetings prior to really thinking about what the impacts were going to be. I think what really struck me at the very beginning was we started to get coronavirus cases. Our first one was March 1st. Our second one was like March 6th, maybe. We had 2 that day. And then I think the 7th or 8th, we had about 6 or something. So at that point now, we've had 10. And then it just took off. And I think that, when we were talking about closing schools, we had a meeting on a Wednesday or something like that. And I was thinking that we wouldn't come back after April vacation. So we'd have another kind of 4 weeks of school, and we wouldn't come back after April vacation. And then literally a day later, we were thinking, can we get through the next week? And then we were saying, we just got to have Monday to pick supplies up. So it really, when you think back on it, it's more than a press conference, but it's daunting what happened after that. Closing schools, canceling the marathon, or postponing the marathon, eventually canceling the marathon, canceling the parade, St. Patrick's Day parade. Every year there seems to be a controversy around it with snow and shorten the route, longer on the route. And this one, I'm like, oh my God, we have to cancel it. And it really has been an incredible year. And that's why when I talk about it, every day here, and Marty talks about it, it really has been stressful for a lot of people, and not just me and the city here, but everyone. It's something that, the St. Patrick's Day this year, fast forward, the bars shut down on St. Patrick's Day last year because there was lines the day before, and they didn't want to deal with the lines. A year later, I'm asking people not to stand in line so that the restaurants don't have to shut their doors down. We're asking people to be careful. The tourism industry in Boston is very important. We had an internal budget meeting yesterday. And tourism for our city is really important for the economy of our city in so many different ways. If we don't get through this virus in the next couple of months here, and the numbers go up again, skyrocket again, well, we're talking, they might lose the whole year here. So we want to make sure that we continue moving forward. But it was an interesting year, and I think at some other time we'll be able to have a good recap about it. But this time last year, we were in the beginning of coronavirus, and a lot of people, friends of mine that I talked to, I told them what was going to happen, or what I thought was going to happen, and I was repeating what I heard. And I think they thought there was something wrong with me. And then 2 weeks later, literally everything shut down, if you remember, and the eeriness of everyone being home, and even all of you guys working remotely and calls, everything stopped. We weren't used to Zoom a year ago. Zoom is a staple in our life today. We weren't, used to all that stuff. It's so much has changed in a year. That's why going back into the schools today. Actually, the other day I went to a few schools. Very careful, but just seeing the kids back on school, it's like they're just happy. And I think that when people can go back to work, they're going to be relieved. And I know traffic's coming, and there's a story in the paper today about traffic with the 4th, whatever it is. I think people will be happy to see traffic for a little while, because that means we get back to some normalcy. And I think we need that in our life. But if we're not careful now, and a lot of work from that first day, or that first press conference I had, I think it was our friend here, till today, an awful lot of work has gone in by everybody. And we're so close to the other side of this now. Let's continue to stay together, stay united, working together. That's going to be key moving forward. But I don't want to be standing, maybe a year from now, somebody will be standing here saying that, in a year we could have been so much further along. We're not. We need to be further along. Thanks, everybody. Have a great day.